XR Body is a unique mixed reality simulator that enables the physical examination of a virtual patient. It is a hybrid technology with no analogs. The simulator is based on a realistic abdominal model with palpable bony landmarks, soft elastic skin, a set of internal organs, both regular and with various pathologies, and the ability to perform percussion. Virtual reality goggles allow the trainee to see the virtual patient full length, examine, palpate, and interpret findings. Controllers are no longer needed during simulation. A system of built-in sensors accurately tracks the position of the hands on the patient's body and the force of pressure on the abdominal wall. Another advantage of XR Body is that it is multilingual. Didactic part. The simulator is equipped with interactive training materials that allow you to learn abdominal cavity boundaries,
left and right costal margins, arches, superior border, mid-axillary lines, lateral border,
abdominal regions,
hypogastric, left iliac,
projection of internal organs on the anterior abdominal wall,
right kidney, the left lobe of the liver, antrum and pyloric section of stomach, the body of the pancreas,
tendinous points of the anterior abdominal wall. The simulator also allows for superficial and deep palpation. At the end of the interactive, the trainee can complete the tasks for self-checking, consolidating the acquired knowledge.
Pear's point, Mayo-Robson point, Desjardins point, Macburn point,
acute abdomen. A unique module allows students to examine a patient with acute abdominal pain, which is not available in traditional training. Features available in this module include: in history taking, the patient responds by text and voice to questions posed.
In the middle. Last night. With spasms.
Unique external manifestations of disease, jaundice, scarring, pallor, hematomas. Depending on the clinical case, different degrees of patient pain reaction to palpation in certain areas. Formulating and making a diagnosis based on examination findings. This module presents 20 clinical cases of the most common surgical and gynecologic conditions. Male and female patients of different ages and visual cues to better understand the clinical picture, such as a transparent abdominal wall with an illuminated three-dimensional pathology model. Clinical propaedeutics. Module for palpation of volumetric abdominal cavity masses. The module allows you to place pathologic organ models inside the simulator to track changes during palpation and percussion of the abdomen. The diagnosis menu contains simulations of 20 different clinical cases. The simulator recognizes superficial and deep palpation based on pressure intensity, with the patient showing different reactions, making training as close to reality as possible.
Ow! Ow! Ah! Ow!
At the end of the module, the identified changes are evaluated by completing a questionnaire. Then, the student receives a final report on the palpation technique and the correct interpretation of the data. XR Body is an effective tool for quality training of future doctors.